And joining us now live this morning from Southeast Health's Graduate Medical Education Clinic is Dr. Juanita Heersink, and we're so delighted to have you this morning. Thanks for waking up early with us.
Good morning. Thanks, Tanya.
Yeah, absolutely. So to start us off, tell us a little bit about yourself. You're relatively new to the area.
I am. My husband and I have lived here about 4 years. I grew up in Montgomery, Alabama originally and went to college at UAB in Birmingham, where I studied engineering, and then actually worked for 2 years in the nonprofit arena and got experience in food security and food access for patients, and then that's what kind of drew me into going back into medicine. So I knew I wanted to do primary care and went to medical school at UAB. I actually met my husband in college, so my husband Juanita Heersink is from the local area, and that's what brought us eventually back to Dothan, Alabama. But I did my medical training and internal medicine residency at UAB, and then did a 1-year fellowship in geriatric medicine, just learning how to take care of patients with geriatric syndromes such as dementia, Parkinson's, and things like that in Oregon before we relocated to the area. So I practiced in a traditional medical clinic for 3 years here, and then in the last year transitioned to teaching at the internal medicine residency program that's new at Southeast Health.
Yeah, and you said your husband is a local dentist here, correct?
He is.
All right. Well, most patients know, what a primary care physician is, but they may not be familiar with an internal medicine residency. So, and what a medical resident is. So, could you explain that, if you would?
I think it's very confusing, and it's a new idea to the area, so we definitely want to educate the community. So, I'll start with what a medical resident is. That's a graduate of a medical school program, and that can be either an allopathic program where they graduate with an MD degree, or an osteopathic program where they graduate with a DO degree.
Right.
And so after that 4 years of training, they're a licensed medical physician, but they do additional training for their career field. So internal medicine residency training is a 3-year program with exposure to aspects of adult medicine in the inpatient hospital arena as well as the outpatient ambulatory arena. So our clinic is the exposure for those licensed physicians in taking care of common ambulatory problems like COPD, heart failure, diabetes.
Okay, and so why is primary care so important, and how do you think your clinic will make a difference here?
Well, what we hear from patients and as a doctor experience every day is that our healthcare system is becoming increasingly fractured. It's 2 or 3 different physicians might care for you while you're in the hospital, a different physician if you discharge to a rehab facility, and then another physician when you get back to the community. And none of those pieces are communicating and working well together. So primary care, when practiced well, is really an eye on preventative medicine and wellness, and your physician should be your quarterback helping you navigate that complicated medical environment. And so that's what our hope is in our internal medicine residency clinic, is that eventually we'll be able to achieve certification to become a patient-centered medical home where we can be kind of a one-stop shop to help people navigate this complicated environment, connect to social work services in the community, and connect to community services for their different chronic medical conditions.
Okay, and if you would, what makes the care received in a teaching environment unique?
Well, I think it's wonderful because if any of you have been hospitalized and been taken care of by these internal medicine residents, they're enthusiastic and energetic. So they take long history and physicals, and they really spend a lot of time with patients trying to diagnose their medical problems and help them navigate the system. We also practice in teams, so it's not just one physician caring for you, it's a physician and an attending, usually sometimes 2 physicians and an attending. So it's a team approach, and there's more continuity. So in our clinic, we really try to see patients in the hospital and get them with that same doctor in the outpatient setting, which is nice as well for patients.
And if you would just tell us what a typical office visit would be like in your resident clinic there.
It shouldn't be too much different than what patients experience from their regular routine doctor visits. It may take a little bit longer, as we talked about, just because the resident physician takes a very thorough history and physical and spends time educating on preventative aspects of medicine, nutrition, exercise, all of those kind of things. They do have to present to an attending physician, and that's where I come in. They present to me, and then we develop a plan together for the patient and usually present it to the patient. So the visit itself, most visits can take anywhere from 30 minutes to an hour, but it's a really thorough office visit.
Comprehensive.
Yeah.
Okay. And lastly, if you would just remind people where y'all are located and your operating hours.
Yes, we're actually right down the street from Southeast Health Hospital. So we're at 1206 Columbia Highway, right around the corner from Mayor Lighting. And we accept same-day appointments, walk-in patients, as well as continuity patients daily from 8 to 5. So I think our physical address is 1206 Columbia Highway.
All right. Well, it was a pleasure to meet you. I've been told we are running out of time, but it was so nice to meet you. Thank you for being here. And as always, if you'd like to get in touch with Dr. Heersink, we're going to put details and her contact information on our website at dothanfirst.com. And still coming up on Wake Up Wiregrass, we have details about a yoga class that will fire you up instead of calming you down. We'll explain on the other side of the break. Stay with us.